There's a health question that many men wonder about, but rarely discuss openly. What does frequent ejaculation actually do to your prostate health? The internet is full of conflicting information. Some sources suggest it's harmful, others claim it's beneficial, and many men are left confused about what's actually true. Here's what makes this topic particularly important. Prostate health affects millions of men, especially as they age, and there's been a lot of fear based misinformation circulating about normal sexual behaviors. What I'm going to share with you today comes from legitimate medical research, including a landmark study from Harvard that followed nearly 32,000 men for almost 2 decades. The findings might genuinely surprise you. This isn't about moral judgments or personal opinions. It's about what peer reviewed scientific research actually shows about ejaculation frequency and prostate health. We'll cover the actual research findings, what they mean for your health, and how this fits into the bigger picture of prostate wellness as you age. One thing to note up front: this is medical and health information based on published research, presented for educational purposes. Let's start by understanding why this question matters so much for men's health. Your prostate is a walnut sized gland that plays a crucial role in reproductive health by producing fluid that nourishes and transports sperm. Why this matters for overall health. As men age, the prostate can develop various issues, from benign enlargement to more serious conditions like prostate cancer, which affects about 1 in 8 men during their lifetime. The confusion around ejaculation frequency stems from decades of mixed messages. Some sources suggested that frequent ejaculation might wear out the prostate or increase inflammation risk. Other theories propose the opposite, that regular ejaculation might actually benefit prostate health through natural physiological processes. For years, these remained largely theoretical debates until researchers decided to conduct rigorous, long-term studies to get definitive answers. Understanding what the science actually shows can help men make informed decisions about their health and dispel unnecessary anxiety about normal sexual behaviors. Now, let's look at what the research revealed. The most comprehensive research on this topic comes from Harvard T.H. Chan School of Public Health, a study that tracked nearly 32,000 men for approximately 18 years. What makes this study particularly valuable? The large sample size and long duration provide much more reliable data than smaller, short-term studies. The key finding that surprised many researchers: men who reported higher ejaculation frequency showed significantly lower rates of prostate cancer development. The specific numbers were striking. Men who ejaculated 21 or more times per month had approximately 33% lower prostate cancer risk compared to those who ejaculated 4 to 7 times monthly. This finding has been supported by additional research, including studies from Australia that found similar protective associations. What's particularly important to understand: this research looked at ejaculation frequency overall, whether from partnered sex, masturbation, or nocturnal emissions. The implications challenged long-standing myths about frequent ejaculation being harmful to prostate health. But understanding the what leads us to the important question of why this association exists. Researchers have developed several plausible explanations for why regular ejaculation might benefit prostate health. The prostate clearance theory suggests that ejaculation helps flush the prostate ducts, similar to how regular use keeps pipes clear. This process may remove old cells, accumulated secretions, and potentially harmful substances before they can cause problems. The cellular turnover hypothesis proposes that regular ejaculation promotes healthier patterns of cell replacement in prostate tissue. When cells divide regularly and efficiently, there may be fewer opportunities for problematic cellular changes to develop. The inflammation reduction theory connects ejaculation to stress relief and lower overall inflammation levels. Since chronic inflammation is associated with various health problems, including cancer risk, this could be another protective mechanism. It's important to note, these are scientifically plausible theories based on what we understand about prostate physiology, but the exact mechanisms are still being studied. What the research clearly shows is the association. Higher ejaculation frequency correlates with lower prostate cancer rates in large, well-conducted studies. This leads to important questions about practical applications. While these findings are encouraging, it's crucial to understand what they do and don't mean. This research shows correlation. not necessarily direct causation. It's possible that men with higher ejaculation frequency also tend to have other health promoting behaviors that contribute to the protective effect. Ejaculation frequency appears to be one factor among many that influence prostate health, not a magic solution that guarantees prevention. The research doesn't suggest there's an optimal frequency everyone should aim for. Rather, it indicates that higher frequencies within normal ranges appear to be associated with health benefits rather than harm. What this means practically, men don't need to worry that normal sexual behaviors are harming their prostate health. In fact, the evidence suggests the opposite. However, this is just one piece of a comprehensive approach to prostate health that includes other important lifestyle factors. Let's discuss what else matters for long-term prostate wellness. Prostate health depends on multiple lifestyle factors working together. Nutrition plays a significant role. Diets rich in fruits, vegetables, and healthy fats support overall prostate health. Foods containing lycopene, like tomatoes, omega-3 fatty acids, like salmon, and green tea have shown particular promise in research. Regular physical activity is crucial. Exercise helps maintain healthy weight and reduces inflammation. Even moderate activity, like 30 minutes of walking most days, can make a meaningful difference. Avoiding harmful substances matters. Smoking and excessive alcohol consumption are associated with increased cancer risks and should be limited or avoided. Weight management is important. Obesity is linked to more aggressive forms of prostate cancer, making healthy weight maintenance valuable for long-term health. Stress management contributes to overall wellness. Chronic stress can affect immune function and inflammation levels throughout the body. Most importantly, regular medical care. Nothing replaces appropriate screening and preventive care, especially for men over 50 or those with family history of prostate problems. Regardless of lifestyle factors, appropriate medical screening remains essential. Current guidelines generally recommend that men discuss prostate screening with their healthcare providers starting around age 50 or earlier if they have risk factors like family history. The PSA, prostate-specific antigen, blood test is a common screening tool, though it's not perfect and should be interpreted by qualified medical professionals. Digital rectal exams remain part of comprehensive prostate evaluation, despite being uncomfortable for many men. The key is having informed discussions with your healthcare provider about your individual risk factors, family history, and appropriate screening timeline. Early detection of prostate problems, whether benign enlargement or more serious conditions, leads to better treatment outcomes. Regular medical care allows for personalized guidance based on your specific health profile and risk factors. This brings us back to our original question and what it all means. So, what does the research tell us about daily masturbation and prostate health? The scientific evidence suggests that frequent ejaculation, far from being harmful, may actually provide some protective benefits for prostate health over the long term. This means men can stop worrying that normal sexual behaviors are damaging their prostate health. The fear-based messaging that has circulated for decades doesn't align with current research findings. However, it's important to maintain perspective. Ejaculation frequency is one factor among many that influence prostate health. It's not a substitute for overall healthy lifestyle choices and regular medical care. The bigger picture includes eating well, staying active, avoiding harmful substances, managing stress, maintaining healthy weight, and having appropriate medical screenings. What's encouraging about this research is that it supports the idea that normal, healthy sexual expression can be part of overall wellness rather than something to worry about. For men concerned about prostate health, focus on comprehensive wellness approaches while staying connected with healthcare providers for appropriate screening and prevention. Important medical disclaimer. This information is educational and based on published research, but it doesn't replace professional medical advice. Always consult with qualified healthcare providers for personalized medical guidance, especially regarding screening recommendations and any health concerns. The key message: normal sexual behaviors appear to support rather than harm prostate health, but they're most beneficial as part of an overall healthy lifestyle approach. What questions do you have about men's health that you'd like to see addressed with scientific evidence? Understanding what research actually shows helps dispel myths and supports informed health decisions.